Good morning, everyone. Today we have an excellent session on leadership beyond the clinic for the BNYS students, doctors. And with us, we have a very well known, famous Dr. Abhishek Devikar. He is an excellent speaker and he is an excellent motivational and a guide for everyone. He has excelled in his field. He has done a lot to the community, and today he is with us for this wonderful session. I have known him for his generosity, his calm and cool behavior, and he is at very esteemed and high post. But I have always seen him calm, cool, and today we would also like to learn this skill from him. He is director at Nisargopshar Ashram Urli Kanchan, which is one of the oldest naturopathy hospital in India, which was being started by our Gandhiji, and they were very doctors who were practicing there. But today, Dr. Abhishek Devikas Bhai has taken it to a very high level, a very recognized level throughout India and abroad, and he is doing excellent work. He is also joint secretary at Central Enigma, as well as he is president of the Enigma Maharashtra chapter. He holds many posts. I was going through his resume, and if I start speaking about it, it may take some 1 or 2 hours. Such a great accomplishments and achievements he has already done in his life. So I feel privileged to have him on today's session, where he'll be guiding all of us on how to go beyond the BNYs, basically how to lead everything, how to be have that leadership skill within us. So without taking much more time, I am handing over the session to Dr. Abhishek Devikar Bhai, who is an excellent speaker and very good-hearted person. We welcome him in today's session. Welcome, Bhai. Please start.
Thank you very much, Vivek Bhai. Thank you for your kind words. It's amazing to be a part of this community and especially this workshop series. I've been seeing the great work Arogya Mandir and Enigma Chhattisgarh is doing. So it's my privilege to be a part of this session today. And I'd be happy to share the insights, the journey I had and my life experiences. If that can help people, I'm the most happiest person today. So leadership is basically not about the position we hold today. It's about the responsibility we take when no one is watching. So I'm really blessed that I started with this profession. And before we dive deep into about today's exact topic, I want to just share a small brief about how my journey started. So, as a small child, we all tend to fall sick and grab some infections, go to doctors. And same happened with me. When I was small, I visited multiple times to the doctors for be it cold, cough, fever, or dengue, chikungunya, typhoid, you name it, and we all suffer it once in our lifetimes. And each time I visited doctors, I asked them that you give me some pills, I consume them, I feel better, but again I fall sick. Is there a remedy where I can just follow something and I don't fall sick? Because I don't want to be away from my school, I don't want to be away from my sport, my friends. I want to enjoy life to the fullest. So, what is the solution? Do you have anything? He said, I can tell you something, but it is a hard way. If you wish to accept, you can please go ahead. And that is when he guided me to Arogya Mandir, which is located in Raipur. And I was fortunate to meet Dr. Vivek Bharti's father, Dr. Shambhudayal Bharti, for the first time. And he examined me. He understood my issues. He gave me a very simple, systematic, yet practical naturopathic approach. And in 3 weeks' time, when I went back to him, I said, I'm feeling amazing. I am without any pills. And last 3 weeks, I have no cold, cough, fever, anything. And that was the turning point of my life where, I felt this is the future of medicine. Because if something can give me happiness, the health I am seeking for, then I think this is the future of medicine which I would like to adopt. And that gradually became my career path. And after pursuing my BNYS, then there was no turning back. I was fortunate to work with the best. of professionals in the country, and we keep learning. Doctor profession is such that we keep learning on everyday basis, and that is how we grow. So we should not forget that this profession demands a lot of our time, energy, and effort all the time. Even if we call ourselves successful, learning is a constant process we should be involved in. So I'll just give you an example. When we go to a doctor like this, in this instance, Dr. Shambhu Dayal Bharti, when I met him, I felt that each person who is falling sick would not like only treatments. They would like right guidance from a leader. And for me, Dr. Shambhu Dayal Bharti was the leader then, with which I got clarity about my body, the functions, and how I can take charge of my health. And we, as a BMS professional, we need to be such leaders because the world needs these kind of leaders to grow, to be happy, to be healthy in today's world. During many such occasions, we see we want to have a look at the leaders whom we can connect. The most famous being in Indian scenario is Mahendra Singh Dhoni. We all look up to him for his leadership qualities. He never went and preached everyone that you have to be a certain way. He led by example. The way he groomed himself, the way he conducted himself, that became the role model for others to follow. We know Virat Kohli, we know Mitali Raj, who is the Dhoni of women's cricket team. So all these people have become leaders not just by talking big things on the screen or just coming out and sharing their thoughts. They have led by example. So I'm going to keep today's presentation structured under these following headings, where we will be covering how practically we can build this skill, yeah, wherein we develop those skills in our life and really have this path where we see that we are growing. We need to be taking charge of our activities, and leadership is something which doesn't happen overnight. It is a constant process. I always say my colleagues and people whom I meet that it's like exercising every day. When we exercise every day, do we see any change? No. In a couple of days, couple of weeks, we don't see any change. But over the period of time, we see that, yeah, after a couple of months, we see there are some changes happening. So leadership is exactly that way. So let's get started. Yeah. Now, coming to the first example, which I would like to quote when talking about leadership beyond the clinic. We are blessed to be in yoga and naturopathy profession, and this is the right time where we can integrate with the other systems of medicine. We all are apprehensive that maybe allopathy or Ayurveda would not accept naturopathy and yoga. I've spoken to many budding naturopaths and they have this apprehension. But my experience is actually the other way around. I've last year I was meeting one of the cardiologist friend who was saying that 30 to 40% of my patients are asking for yoga, diet, stress management, and I used to just say them that all this doesn't work. You just take these pills and you'll be fine. And gradually, same doctor came to me, same friend came to me that now we have a high demand for this stress management and nutrition, along with some yoga and meditation if you can offer. I said we BNYS professionals are expert in this, and we would be really happy to collaborate and take it to another level. And that was the day, close to 10 months ago, we started with them. And now in two or three of their branches, we have our small outlet where our doctors go and they are offering diet, yoga, and stress management sessions for their patients who are coming to these allopathy hospitals. Now they have embraced us, and the credibility is growing. The people who attend to us, they understand that naturopathy and yoga is something which can really help. And it's not only those patients; it's even the doctors who are the panelists in the hospital. They also understand, and it is growing by the word of mouth, and that is what we expertise in. So we should not forget that world needs experts and not average mediocre guidance. So if we are experts in what we are doing, then we are going to be successful. We can easily collaborate and go ahead. Yeah. So that brings us to the most important part, that is the new landscape of integrative medicine. Now, conventional medicine is something which everybody has known. Now, allopathy is famous, but we know that there are challenges, there are limitations it carries. When it comes to lifestyle disorders, they cannot cater to majority of diseases in today's world. Along with conventional medicines, Ayurveda, homeopathy, and other Ayush systems are also offering a great, you know, spread of treatment options. But at the same time, it's up to the people whether they want to be dependent on a particular drug, a pill, or a supplement, or you want to take charge of your medicines. That is your naturopathic medicine. Now, I want to convey to all of you that along with naturopathy and yoga, all these systems of medicines are doing well. And when we integratively practice, the faith a patient shows is immense. Nowadays, with the lifestyle diseases at all-time high, we know that people are juggling with their routines, with their stress levels. The mental health is highly compromised. And that is the seat of most of the disease in today's world. Once you have stress, the blood pressure rises, the endocrinal system goes for a toss. You start seeing pre-diabetic levels, and then gradually cholesterol levels. Nowadays, we also see fatty liver being a very common problem among the youngsters as well as the middle age groups. So the diseases are gradually growing just because of a poor lifestyle. And that is where we can play an important role there. So when we integrate people who are on their medications for diabetes or for your cardiac problems, hypertension, when we join hands together, we give them a very practical naturopathic diet. We give them various tools like pranayam and meditation. And when they start practicing, they start feeling better mentally. And then physical changes also start to happen in a couple of weeks. So their parameters starts improving. They starts feeling better. And that is the time where they build immense trust and faith in naturopathic medicine. So we should not be skeptic about allopathy or Ayurvedic medicines. We should work together. And then naturally, when the need of medicine comes down, we can actually taper it down very systematically in consultation with their treating doctors. And that is how we build integration in medicine. Yeah. In COVID, we have also seen that people have many options. They are going to hospitals, they are taking these pills, but they are frequently falling sick. Each time a new virus comes, we become the prey to this particular virus. We start looking for options. Everybody start running around different hospitals, but there's no cure. Now, we also understand that naturopathy offers a wide array of treatments and therapies which can make you strong from within. And that is the way we should be propagating ourselves such that everybody can stay healthy from within, so that each time a virus becomes active in the environment, it doesn't really affect us. Now, another important area which I would like to show in this slide is the epigenetics. The lifestyle, what we adopt, immediately makes a difference in our physical health. The stress levels, the diet, the sleeping habits, the environmental conditions, all this affect our health. And that is going to be the next important area where we all need to start working on. There should be more researches. I'm sure there are researches already being happening in this particular area, epigenetics, to understand how we can control this and make a very healthy community around us. The next important thing what I've been observing last couple of years is the corporates. All the MNCs are adopting this naturopathic and yogic culture so that they can improve the working efficiency of their clients, the people they are working with, and especially their core team, because the kind of work pressure they are under going on a daily basis is immense, and that is compromising their efficiency. So we have also tied up with many corporates where we offer customized programs for their employees such that their mental health can be taken care, and they are given very small capsulated programs such that they can de-stress during the work hours and again come back to work. And that has gradually shown an improvement in their career paths, the way they have been functioning. So this is something which gives us confidence as naturopaths, as BMS professionals. There is no inhibition from the community. It's about the expertise. You understand what you are good at, how you can collaborate, how you can help people in their actual problems on a daily basis, and that is how we can grow. Similarly, we have been approached by schools. Schools, you would have heard that yoga has become a very common practice. It has become an integral part of their activity where the school children are made to practice yoga at least weekly once. Now, again, the reason behind is we all lack focus and attention. With the social media always on the go, we have drastically cut down our attention span. And that is reflected even in the small kids now. So, if there is no focus and attention, whatever is being taught to them by the teachers, they are not able to grasp that. They are there physically, but mentally they are not able to grasp what has been explained. And that is why schools have come up with this plan of incorporating yoga into their routine. And when we are doing yoga with the children, we see that in a couple of months, they become very calm, they become very quiet, they want to understand, they are physically and mentally involved in the activity, and that gives us again so much of happiness that working with the kids, working with the schools, we are working with the
कोई
youth,
काम तो नहीं कर रहे हो?
and we are making this happen through
डॉक्टर
just
देवकर ना कोई
their
मीटिंग अटेंड कर रहे हैं।
meditation and yoga. So simple tools but incorporated in the right manner at the right time can make a lot of difference. And the last thing what gives us a proud feeling that even the hospitals like Hiranandani and Tata Memorial Hospital in Mumbai, who have been cancer specialists and known for their amazing healthcare infrastructures, have got a couple of patients from Nisargopchar Ashram who had cancer, whose parameters were not well, and they were asked for chemo and radiation. But following a 2 to 3 week program at our Nisargopchar Ashram, when they went back to their doctors, their parameters improved drastically. And then the doctors from Tata Memorial calls us and asks that, what exactly are you doing in naturopathy and yoga that there are dramatic results here? How can we collaborate? And can we have a small satellite center of yours here in Mumbai where we can divert our patients who are into chemo or radiation or in the beginning of their cancer. Maybe the initial diagnosis happens and immediately they are sent to you so that we don't really need to go to this chemo, radiation, and surgical interventions. So this is the future of medicine, what I was talking about. Integration happens when your results talk aloud. We don't have to go and talk big things, but the patients improve, they themselves go show their readings and their results speak aloud. So this is what we should be looking at. Yeah. So going further, now I see that BNYS professionals are generally underutilized. Our role is expanding because we have a lot to offer. We can have amazing expertise in what we are doing. So, what can we do? That is the next question. I was told that in this particular group, we have interns, we have students, we have budding naturopaths, and clinicians and researchers as well. So, while you're a student itself, you should be understanding what interests you during the college days. If you are into internship, then when you are going to different hospitals, you will see that how therapy is really helping people getting better of their diseases, improving their health standards, and attaining fitness. So while you are into this process, you observe everything closely. You should also understand what interests you as a doctor first. If you are interested in giving a good nutritional diet, you can frame that itself can become a career path. Nowadays, people want amazing naturopathic nutrition where they are following everything and they get results. Ultimately, it's all about results. So, just being a naturopath is not good enough, but you need to be expert in something which interests you. You should be passionate about what you are doing. And going further, if you're expert in yoga, if you are doing meditation, if you are good in acupuncture, if you are into physiotherapy, there is no hindrance in the career path, but it needs to start early in your career. Just while being the student or being in the internship, all these thoughts should start reflecting into your character. Recently, I was talking to one of the young doctor who told me, "Sir, my clinic is running, but I see around 10 to 12 patients on a daily basis. But last 2 years, it is not growing. I feel I am stagnating." Now, this is what brings us to a very interesting point, that is clinic ceiling syndrome, where you're doing everything right, but you're not growing. So, what is you are doing right, but still you're not growing needs to be understood. Your talent is growing. You feel that you are growing, but the clinical practice doesn't grow. So we all generally face very common problems in a clinical setup where the number of patients keep fluctuating. Sometimes they are 5 to 10, sometimes they reach 15 to 20. But we see that the visibility we have in the community is very limited. And as a solo proprietor of the clinic, it becomes very stressful that you manage the operations, you manage the patients, you manage the accounts. Everything becomes very overwhelming. And there are no structures, programs. We just want patients to come, treat them, and give results. But with the competitive environment around us, that is not enough. We need to collaborate, which we lack big time in naturopathy setups. Collaborations are must in today's world. And then you see that with collaborations, the visibility grows. The medical community starts recognizing your presence. And that is what is important. Now, in the usual model, we see that initial 5 years is the struggle period where we want to establish our clinics, and then gradually we understand that it's not working. And that is why we need to have a parallel setup. Along with the clinical practice, we need to do some parallel work along with it. Most of the times it happens that whatever we do parallelly is not seen because we may be writing articles, we may be giving some health talks, we may be uh, doing some small research, but that doesn't come into notice. It is a lot of effort, but again, it doesn't attract visibility. And that is the time where the most important part comes, where you collaborate and you scale up your clinical practice. So clinic is your base, but it's not your destination. Understand and remember that leadership begins when you step outside your clinic. We all try to confine ourselves into the four walls of this clinic and give our best there, but it doesn't work. So when you go out of your clinic into the community, into the hospitals, and you start networking in different fields, especially allopaths and Ayurveda acharyas, then you see that the OPD practice grows. You start getting referral, you send patients to them, you interact with them, what works best in allopathy, what works best in naturopathy. When we interact, then the collaborations and interactions increases in the community. And that is what we all should look forward to. Now, tell me, among this particular group we have here, how many of you would be doing an OPD practice after 10 years? I don't think it is practically possible to stick to just this clinical setup for many such years, because there is an interesting study I have quoted here where over 45 countries were studied, over 1 lakh physicians were studied, and there was a high burnout ratio among those doctors, which is from 0 to 80.5% at different point in time in their life. So definitely we don't want to reach that burnout phase. Yeah. And that is why leadership beyond clinic is no longer an option. We are all physically exhausting ourselves. The financial limitations and burden keep on increasing. The system becomes very fragile that if number of patients are not falling in the radar, then automatically your finance, your accounts, your presence itself, your existence itself is questioned. You start to shake whether I should close down my clinic. And as a clinician, you would be able to heal a couple of individuals, but as a leader, you can heal population, and that is what is required. Globally, the whole scenario of healthcare is now shifting because treatment is for emergency, prevention is what we all are looking forward to, and we need to make such systems where actually we make a difference in people's life. You give a program to them, they follow, and they remain healthy for a couple of years. They come back to you happy that you said me a simple mantra of avoiding sugar. I started following it, and from that day, I started losing weight. My sugar levels are normal, and I feel more light. I feel more energetic. Such kind of small yet practical knowledge guidance is required to be transferred to community. You can't be going to one patient and teaching them how you have to correct your lifestyle. That is a old model now. We need to scale it up. We have to target a larger audience. There is a big market there who wants correct guidance. So we need to focus on that. Now, another big challenge we all as BNYS professionals or naturopathy communities facing is about the advocacy. And if we don't integrate, we will be crushed by other systems because uh, everybody feels that they are superior, they are better than the other system. It's not that way. We should respect what is good in other systems of medicine, embrace what can work best for our patients, and in the best interest of patient, whatever is right, we should be able to administer or refer to the other tertiary care as and when required. Now, another issue is if we remain aloof from other systems of medicine, then we would be marginal because we'll be isolated in the corners, and there'll be very handful of people who will be knowing and following naturopathy and yoga in their lives. So we should not let that happen, and just integrating with people, communicating in the right sense will make a lot of difference. Yeah. Now, what leadership actually means in yoga and naturopathy. Many people confuse leadership as an authority. You are given a title or a post or a big administrative role, and then we feel that that is what leadership is. It's just not that. When you want to be a leader or you are in the process of becoming a leader, it's just you take the responsibility of a certain thing you want to change. You take responsibility for the outcomes beyond your control. There are many problems in the community right now. Like, as I told, advocacy is another problem, and collaborating with people is another problem. We as leaders need to build programs. We need to train others. We have to have policy making. We need to generate substantial data and evidences about naturopathy and yoga practice and create access for the youngsters to come in and express themselves in the best of their abilities. That is what we leaders have to do. So our community needs a lot of leaders because challenges are many and the scope is huge. So we should not limit it. So I'm going to talk about 6 pillars of leadership, which will actually enhance our career path, be it a student's life, be it an intern or you are a clinician. Following these 6 pillars, you will be able to see that you will be scaling up your entire growth process. Yeah. So I can remember one important conversation with one of the patient. The patient told me, I was referred to you, and I was surprised that one of the allopathy doctor referred me to you. And I was questioning myself, am I doing the right thing going to a naturopathy doctor? But after meeting you, I felt that you understood my problem. You have sound knowledge about medicine, and without any confusion, you gave me the treatment program. And after following, I understood that I was in the safest hands because what is happening currently in the world is people exploit we patients at every step. The moment we enter list of tests to be done, blood test, and then other investigative procedures, and then medicines, and then it becomes a vicious cycle for rest of the life. I was amazed to see that one of the allopathy doctor referring me to a naturopathy doctor, which actually changed everything for me. My entire perspective towards naturopathy changed after I met you. Now, this was a breakthrough for me myself because I never imagined that I'll be referred by an allopathy doctor. And then I was stuck and I was, what should I do now? Is it a good thing or it's a bad thing? So I went a step further. I spoke to that particular doctor who referred this patient to me and I asked, what made you think about me as the best option? How could you think of referring this patient to me? He said, we have been getting many people who say that we went to your center and we got amazing results. Our medicines were weaned off. Without medicines, we are able to maintain good health, our sugar levels or blood pressure levels. So that made me understand that there is something right you are doing. Although I don't know much about naturopathy, but I understood from patients that you are a good doctor. So that is why I have sent. Otherwise, nothing much I had in my mind. So this is what, you know, can happen to all of us. And for that, we have to just ensure that we do right things. We need to be ethical with our patients, guide them in best of their interest. Yeah. So that brings us to the identity, what we can build. And we have to build a clear identity about ourselves. So what we are good at. Now, a simple truth which I would like to tell all of you is patient would never look at what you were as a student, what marks you achieved in your college curriculum, what certificates you carry, what is your current designation. All this would not matter once you come and sit as a doctor in the consultation room. What is important is whether patient was able to be understood by the doctor, whether his problem was heard properly, whether they could have a connect with the doctor, and then what was conveyed to them brought a change. This is what everybody is looking at in today's world. And that is where we all naturopaths can excel. And building this clear identity would be not so difficult if you follow this simple step where you have to be a good listener, you listen to them, understand what went wrong in their lifestyle, explain them this was the particular habit you were adopting till now, which has actually given rise to this condition. And if you just correct this habit, then you can reverse your health condition towards a better cause. Now, what we do here is, along with all these practices, we share patient outcomes with them. We give them examples that we had similar patient in our clinic or the hospital where following these many days of regime, they improve drastically. And that gives them confidence. So patient would go and they can talk to the other patient, ask them that, is it true? What did you do? And how did it help them? Just following the simple steps, they see that, yes, it is working for me. And then they start following you. So this kind of clear identity is a must. It's, I would not call it branding yourself, but gradually you become a brand because what you're advocating to the patients, people are able to understand that, okay, what you're saying is not just a sentence, you mean it and you have delivered it. So that is what everybody wants it. Making a consistent statement through your work is what is going to help all of us. Now, to achieve this, we all need to be a good storyteller. We need to communicate in a way that the patient understands that we are not a quack, we are not a fake, and we are not somebody who is just giving false claims. I've seen many people in our community in Ayush systems of medicine that they say, I have treated this condition, you'll be fine in just 2 months. And practically, it is impossible to give that kind of a sentence to any patient that I can cure you. We can give a try. Being overconfident makes patient feel that you are boasting yourself and it is too tall a claim. What rather I would suggest is we should be promising just 60 to 70% and deliver 100%. That is what gives them confidence in you. So when you are 100% confident, you can say that we can expect 60 to 70% result in this 2 weeks program what I'm offering you. And let us see, if you stick to the program, if you are compliant enough, then you will see that you can surpass the 60-70%. And then actually that happens where people start following with less of expectation, but they are given much beyond than what they expected. And we all are very generally happy if we get more than what we expect. So we should be promising less but delivering more. Now, this is something going to be very crucial. These things are not taught in the college, no workshops, but ultimately, this is what we learn from our journey, how we treat patients and how they respond back. Based on this, we understand how changes are required. So, communication skill is something we all need to adopt. And it is not that you do a workshop and you become a master. That never happens. For that, you need to practice. So, communication, storytelling, for that, I would suggest all of you to make sure that you go for small public programs, give public talks. Let it be a small crunch topic, but talk in public. You have to come out of your fears. The stage fear we all must be carrying, the apprehension because so many learned naturopaths or allopaths are in front of us would give you some goosebumps. But you should be able to communicate what you exactly want to express. And that is what is communication. You are saying your point, you make sense to it, the other recipient understands it and reflect it. That is how the communication arc completes. And when you say a story, there are a lot of hormones are secreted in the brain. It's a pure science. So communication skill is a must for a naturopath or a BNYS professional because we interact a lot with our patients. And without interaction, it's impossible to understand their problem. We understand their problem, we can be able to give a right solution to them. Yeah. So coming to the third pillar, that is building a connected innovation ecosystem. Now, when I'm talking about building a connected innovation ecosystem, it's about making different modules and programs out of your own innovative skills such that the client base you are offering should become a wide spread of treatment options from which a patients can choose from. Now, not everybody is happy when they are taught yoga, or some people don't like meditation because when they sit quietly with closed eyes, they get a lot of thoughts. So they don't like meditation. So you should be able to teach them pranayam. If that doesn't work, then you should be able to give them guided meditation or yoga nidra. Similarly, you can give them very specific yoga module where they are constantly engaged into breath awareness, body movements, and the effect which they are going to get after the certain practice of yoga asanas. So this is what we call building a connected innovation ecosystem. If we don't do this, we can't be very rigid in naturopathy saying that you have to have millets in your lunch from today onwards. That practically doesn't work. Somebody who has never eaten millets cannot digest it. And if you're very rigid about it, they have many other options. What they can best do is not come back to you and go to somebody who can give them options. So, this is what we have to be building into our practice, that is flexibility. We can't be rigid in our practice. And just following certain standard protocols should not be the complete focus of our ecosystem. Now, in this ecosystem, we can have many other things developed. For example, we can have yoga modules, we can have acupuncture, we can have dietary guidance. So, to make it reach out to different people and connect with different people, we can make different programs. I can give you an example of one naturopath in Pune. When he started, he had hardly 5 to 7 patients coming to him for rest for almost 6 to 8 months. And then he started with this particular practice where he made small, small programs, 3 days, 4 days, 5 days, and weekend programs. And he popularized those programs. Now, people wanted some break at the end of the week, and they thought, let us do something healthy. And that is how they came to him, started following those 3 days programs where a simple diet he offered, some meditation and pranayam along with it. And that was where he clicked. Now he has four clinics in Pune and he's doing so good. He's quite famous here in Pune now. And people recognize him because he made those capsule programs where people has a lot of options, you know, not sticking to a particular time that you should be coming only in the weekdays. He was available on the weekdays, weekends, mornings, evenings. He understood the market, that which is a time where people are actually free, where they can spend time on themselves. So giving those programs at those timings made a difference. So this is what we all leaders or clinicians should be aspiring to do, giving more options to the patients, and that is how things can move further. Another area where we have a huge scope is the senior citizens. Now, after we all are working, we tend to degenerate. We all start getting neck pain, back pain, arthritis of the knees, a lot of gut health issues, and especially senior citizens after retirement have a lot of these issues. Now, they want to get it addressed. There's no pill which can cure your arthritis or spondylosis or even a gut problem. And that is when we come into picture. We naturopaths, we BNYS professionals can actually cater to this huge community which wants right guidance. So even today we have almost 40% of our patient number coming from this senior citizen groups. And they are amazing because they are actual patients. They want to follow something which helps them. And the program we deliver it to them, they get amazing results. So that is how we have a lot of word of mouth, people coming from the same community, and they are asking us to have more outlets, more different, more clinics and hospitals in Maharashtra. So what I'm trying to say is there is a huge scope. There is no inhibition from the community. It's up to us how we cater to the needs of the community, and then there's no turning back. Yeah. So for this, we have to collaborate with Ayurveda, Unani, Siddha, homeopathy, allopathy, even other systems of medicine, because they need to add these new therapies in their system. Now, I'll give you an example. One of the hospitals who was multi-specialty hospital in Pune, they were doing very good. They were running full. But after COVID, suddenly their patient numbers dropped. And it was a time where the management started thinking, what is not right? And there was a demand of people asking them, do you have some meditation? Do you have some yoga programs? Do you have some diet consultation? Why? Because people understood that during COVID, the access to medical healthcare system is also limited. So they collaborated with us and we gave them teleconsultations in naturopathy, diet, and yoga. We started online yoga programs. We gave them counseling online. And with that, the credibility of the institute grew. The hospital again started growing in number, and our visibility also went up with them. So it was a real collaboration between naturopathy and allopathy, where we worked hand in hand. In couple of cases, we took their case studies, we spoke to their doctors, what is the actual problem in the patient, what are the results, and then what are we going to offer. So collaboratively, when we worked, the results were much better. And that is what we all need to do going ahead. Now, talking of community leadership, which is the fifth important uh, pillar while talking of the leadership program, uh, we all want to reach the top, right? We all want to be successful, but we don't know what is the path towards it. Now, in the community, there are many people. Like if you take example of BNYS community, there are thousands and thousands of students, interns, clinicians, practitioners. But we don't know many leaders. We have just handful of names with us. And for the community to grow, we need more leaders. For ourselves to grow, we need to have those leadership qualities. Now, the simple way what I see around us is to be the leader in the community, you need to adopt a practice and keep doing it. I met one of the doctor in our proximity who is a BNYS, of course, and she started doing yoga in her community, in her society. Looking at her in the garden, there are many other people started joining her. In just a month's time, it became 30 to 40 people following yoga with her. And soon after that, there was one of the doctor who was the participant in that yoga group. The doctor offered this naturopath lady to conduct regular yoga in their hospital. So that is how immediately she got a chance to work in a hospital setup, which she was not prepared for, which she was not aiming at. But just doing something in the community can give you a leadership role. You need to outstand, come out of your comfort zone in such a way that people recognize you that you are good at something. And when you're offering something easy, accessible, and practical to the community, they make you the leader for that. And that is what happens in most of the scenarios we look around. People, they are going to be recognized only if they express what they are good at. So you just need to be doing what you're good at and not hesitate. Now, the biggest challenge what we all face is we are skeptic, we are scared, we are nervous. So we don't want to tell the world what we are good at. We are still waiting for an opportunity where we can get a lot of time to prepare, come out and express. That usually doesn't happen. If you are interacting with a group, you get a chance, you need to tell whatever you know. And that is what is lacking currently. So in community leadership, I can tell you an example that we have people like last session was done by Dr. Ashwath Hegde. He has been doing amazing work. You know, whatever he has learned during his practice, whatever he has been learning, he's just sharing with others. We have Dr. Pradeep Nair, who has been a budding naturopath when we started together in Nisargopchar Ashram while he was doing his internship. And he just kept on doing what he was good at. And today, now he is a recognized leader in terms of naturopathy research. So such more passionate naturopaths are required to just embrace what you're good at and start doing it. There are many other areas like arthritis management, obesity reversal, women's hormonal health, digestive problems, sleep and longevity, which I expertise in. So there are many areas we all can just adopt whatever we like and just start helping the community. This is how we can give back to the community, and community will come to us to recognize and take advantage of our knowledge. This is how we should be growing as a community leader. Yeah. So the sixth pillar is about institutional growth. If you're running a clinic, how you can convert it into hospital, or if you are a student and you are struggling in internship, what I should be doing. Dr. Ashwath Hegde has shared a lot about your career options, but I'm going to talk about how you can take a leap in this direction. So we all as clinicians, we want to have a bigger hospital, bigger setup, but it's not easy to have that amount of funding, and it's not easy to have that amount of understanding to just convert our clinic into hospital. What is crucial is you understand the process. Now, from clinic, if you're running completely full and pack for like 8 to 10 months in a year, then maybe you can think of converting it into hospital. For that, you should be well aware of the communication skills, the financial problems you would be facing, and along with that, you need a lot of administrative qualities as well. So, what I'm going to share briefly now is how you can take this pathway such that you can be able to start a college, hospital, or academic institute. Now, along with this communication skill, which we understood now, we need knowledge about how to manage team and people. Managing team and people is something very complicated because we don't generally deal with people. The way it is said and understood is different. And for that, what I would suggest is we should be meeting more people, working together. Even in internship, or working with volunteer groups or students, we should be able to extract work, because managing people and team is the crux of running a clinic or a hospital in a most efficient way. Because as a leader, what you want to get it done, it can happen only if people understand what you want to say. They can visualize what is your dream, what growth or career path you are looking at, how you want to grow this system as well as the institute. For that, you have to be managing people and understanding them well, so that you can reflect it properly in the process. Along with this, if you are working with different projects or you're conducting different programs, there are options where you can have government grants. You can work with NGOs where some funding can happen. You can work with different groups where the variables are shared in common. If a NGO is working for poor people, where they want to reach out to the remotest of place and they want to improve their health standards. But the problem for them is execution, because they have funds, but they don't have expert manpower. Now, we being naturopaths, we being BNYS professionals, can actually play an important role. Like what we do here is we are working with a couple of NGOs where they have a deeper reach in the rural areas, and to benefit them in terms of their health, we have developed some community health programs. And these community health programs, the NGO contacts them through the SHGs, that is self-help groups, in their cluster meetings, which happens every month. And we as community health providers, we go to them in their setup. We give them guidance about the diet, the yoga, and what are the lifestyle changes they can do in their rural setups, in their rural setting. And that makes a lot of difference in their health standards. So people who need treatment, they come back to us either in the clinic or in the hospital for OPD treatments or IPD treatments. The funding happens through NGOs, and the results are reaching to masses, especially in the community we are targeting. So this is how we can actually scale up our presence, and we can have more fundings. Gradually going forward, we can also get grants from government institutes. There are many other projects which you can ask the government. They do the funding and you can scale up your practice in that direction. So this is how you can be doing. Along with this, you need to have some financial and administrative literacy. It's not easy to do these projects, but not being aware of the financial framework, you need to document everything as per the format given by the government or the advocacy licensing company. Be it NGO or a corporate, you need to document all your expenses, all your systems, what you have been following. So that is how you would able to be surviving in the industry. Otherwise, it becomes difficult for you to be in the project. You will not get further projects. Same thing works when it comes for the research and other practices. If you want research funding, same thing happens. You have to apply for research grant. You need to give the proposals. They understand the quality of research you are going to conduct at your center, and then you get the funds. Once you get the funds, how you have utilized, you have to express in form of the documents. You can't verbally go and say them that we have used this amount of fund for this particular activity. Everything has to be transparent and clear in a way that the agency understands that it has actually happened. That is how the practice should be. So our actual practice should be conveyed, what we have followed, and that is how the credibility of the institute grows. Once the credibility of institute grows, we along with the process grow automatically, because we are the face of the institute. We can do whatever we want if it is in the right sense, if it is done ethically, if it is done in the right way, if you're following evidence-based practice, then of course research is also very well accepted. I'll give you a small example where a diabetologist came to our clinic, and he was a very renowned practitioner in Pune, and his sugar levels were roaring high. His HbA1c was 13, and because of his stressful clinical practice, he was not able to follow the right diet, and his health was really going bad. After he came to naturopathy and he started following all this guidelines, he started seeing immense change in 3 months. His HbA1c came down to 9 and he lost a lot of weight. He started feeling light and confident again. And in couple of months, when he came for the OPD, later for the IPD practice, he understood that I was very busy. I was not giving him much time. And that is when he said me, looks like doctor, you are doing very well. I said, yes, with God's grace, I'm doing very well. I'm managing the hospital. I'm a part of this NGO. I'm collaborating with many other institutes. He said, as a patient, I would like to give you an advice. I always felt that you are a very good doctor, but in the process of your growth, I don't want the community to miss a great doctor. So please don't forget that while you are busy into other things, patient like us would be really missing you. So it's also important that we stick to our passion. First, we are a doctor, and then we are going to be a leader. We need to reach masses, but at the same time, we need to be grounded. We need to be present, and our expertise should be of use to the community. If that doesn't happen, then our clinic will not convert into hospital. So that is what we all should be aiming at, being grounded and being able to understand what is required in our community, identify those points and start delivering it according to the need of the community. If we do that, then we see that the growth is exponential. We have a huge scope because the population of the country is so much. The challenges what we are facing as a healthcare community are immense. So going further, I would like to just brief you now about an important area that, along with these things, make sure that you attend all the conferences, the CMEs, build your profile, what you're good at, and stay connected in the community. Because even in our community, many a times we don't know who is good at what. And for that, you need to go and meet people. And the best way to meet people is during these CMEs, the conferences, the workshop we conduct. I would not be very happy with online programs, but it makes us accessible to all of us. So online programs are good, but physically meeting people, expressing what you are good at is the next thing we all should be looking at, because only then we understand what we are good at. Now, next thing is to scale up the whole process. You should also be thinking about having case studies. Now, we all in the clinic, while sitting, we treat patients, but we don't really document their changes. If the changes are going to be good or bad, both the things required to be documented in a way that we understand this was the problem, this was the intervention given to them, and this was the result. If we document this process, we can always correct the flaws in our intervention or the entire process which was given to them. If it succeeds as a good study, you can always publish as single case report. Now, most of the allopathy doctors tell me that you are doing so good, but why the modern world doesn't accept you? Why you don't have a global presence? And that made me think, where are we lacking? This was 8 years ago when taking charge of the hospital, we saw that we are doing so good, but the global presence is lacking. And that is when we started looking at the processes. What process is being followed? Are there any lacunae there? And then we understood we are not communicating to the external world in the evidence based language which they understand. The world expects us, especially the modern medicine, the conventional doctors expect us to talk in scientific language which they understand. If we start doing it, then we become BNYS professionals and not just some diploma holders, how they express. The difference has to be there between a diploma holder and a graduate. If you're expert, we might have done MD, PhD, MSc. That has to reflect in our conversation. That has to reflect in the scientific language we use while expressing our thoughts. So that is something we all need to take up. Going further, what are the career options we can have beyond the clinic? We may have many options like becoming a academician, or we can have integrated hospital roles. Let's quickly have a look at what are the options we have. If you want to become an academic leader, we can have university faculties we can become. You can have curriculum design for yoga therapy, integrative health programs. We are everywhere, whether being the principal of a college or dean of a university, program directors. We can conduct online education platforms where we offer different programs, different skill sets to the budding naturopaths and graduates. We can have integrative hospital roles. Nowadays, there is a new opening I am seeing where hospitals have allopathy as well as yoga and naturopathy department, and they need integrative medicine coordinator who can actually coordinate all different systems of medicine for the patients, so that there is no confusion. They get best of results from each and every system of medicine. So that is another area we can excel in. Lifestyle medicine physician we can be. Yoga and medicine, yoga and mind body program we can be heading into. There is huge scope in cancer and rehabilitation. So that is the area. Research and evidence generation we can be doing. Public health and policy making is something we all need to be doing, but it needs a lot of expertise. Gradually, when we run through all these processes for a couple of years, we understand that what is the process to incorporate yoga and naturopathy into Ayurveda. Uh, Ayurveda people have started now practicing yoga along with it. So similarly, this kind of integration can further grow. And to make it happen at the state level or the national level, we need to be present and working closely with the government. And we are fortunate to be doing that in Maharashtra, but it is happening in other states also. But at the central level also, it should happen. And for that, we all need to evolve as leaders and be there in the making of this process. The policy making is something very crucial for we naturopaths, and for that, we all need to step up and contribute as much as possible. Similarly, school and community health programs, there are a lot of CSR groups which they want naturopathy and yoga professionals to lead, so that they can reach to the rural populations and they can create an impact. Similarly, corporate and occupational health programs are something where we can excel. We can be entrepreneurs, we can be having our wellness retreats, digital health programs, teleclinics where you don't have a physical clinic but you have an online presence. Then we can have training institutes. So based on our interest, we can go further, dive deep into those subjects. We can be into writing, whether it is research proposals or even in insurance. Nowadays, a lot of BNYS professionals are opting to be into the insurance, where they become a part of this Mediclaim system, and they help the insurance companies. Similarly, we can write columns, we can be doing the podcast, we can be the host for that, we can be authors, we can be educators, we can be doing content writing. Medical content writing is something which is again looking at. Uh, Looking at the current scenario of AI, it has suddenly come down, but the real companies still needs them. The good companies, the bigger publishing house don't rely on AI, so they need medical content writing. So I would suggest all of you to just write down what is the rating you would like to give for each columns I have mentioned here. Where between 1 and 5 you can rate your interest, what is the skill match, the lifestyle fit, if you really feel that it fits my personality, the kind of income you might get from this, and how long-term impact can be created through these processes. If you just rate yourself, you'll be able to analyze that what is your passion, what you are interested in, and that is how you'll be able to pinpoint what exactly you want to do in life. Just being a clinician, or you want to do some parallel activity, and then that grows huge enough to make you comfortable for rest of the life. So with this, leadership choices must be strategic. You need to have these kind of strategies to pinpoint your interest and not being emotional about it. Now, one simple thing I would like to come back to you again is the journey to be a leader is not going to be organic. It's not going to be sudden. We all tend to stay in the comfort zone, but we need to come out of the comfort zone, be it public speaking, be it meeting people in the conferences, presenting our work, anywhere and everywhere. We need to come out of our comfort zone each time. And that is what will make a lot of difference. It's about the consistency, and it's not about once in a while just appearing some places and just trying to showcase what you have. Each time you will have to be there, and even if you're not comfortable, you will have to start making sure that you're always being present in most of the important occasions. That's how you can evolve as an important leader in the community. Now, I'll just run through some important common transitions we all can have. That is about, if you're a clinician, we can also become an educator. If you're a clinician, you can lead some integrative programs. Recently, we have done this in Pune and even in Mumbai, a couple of centers where I was asked to collaborate with Ayurveda, Siddha, Unani, and from naturopathy and yoga front, I was representing. And the allopathy doctors also, I was trying to coordinate with all of them, where we made a program such that people walk into that particular center and they can choose naturopathy, Ayurveda, homeopathy, whichever system they want, and only those systems of medicines will be working on that particular patient. So they'll be asked to do consultation with Ayurveda Acharya, with allopathy doctor, with a naturopathy doctor, and their programs are converted into a single treatment. So the medicines they have to consume, the diet they have to follow, the yoga they have to practice, everything is planned in a combined fashion such that it becomes practically possible for a patient to follow it, see the result, and then continue it further. Next areas from clinician, we can become research contributor. For that, documentation in a clinical setup is a must. We all must do. From being clinical setup, we can also become entrepreneur. We can enter into business industry where we can have certain health products which interest patients because they would need at every point in time. So if those can be manufactured and marketed by us, we have a huge scope there as well. And for this, we need to remember that this doesn't happen overnight. We need to juggle between these parallel roles. This is unavoidable without taxing us physically and mentally, but patiently we have to make sure that we see what works best for us, for our situation, and then take it to the next level. So this is a voluntary responsibility we all should be taking. Initially, we may not have good visibility, but gradually people will start seeing it. So it will grow into phases and not directly there'll be a jump from clinic to directly hospital. So you can't think of taking bigger leaps, but in a phase-wise manner, it will definitely happen. For this, I'll just like to share a three-phase transition model with you. So in phase one, we would see clinical credibility, strong practice if we have, and if you're documenting it very well. In the next parallel track, we are doing some research, we are doing some online programs, some talks, and then gradually our volume becomes bigger. More people are getting affected, impacted with our practice, and each time we do something, we add more value to their experience. So whatever we are doing, we can't be just doing monotonously the same thing. We need to add more knowledge and expertise there. And that is how people will start valuing your advice. You follow, you practice, and you teach. This is how people will have a role model kind of a feeling for you. I can just quote an example. Yesterday, it so happened that I was in the clinic and one of the ex-MLA came to me and he has left the political career because he's not happy with the way the government is functioning. He has some wider goals and he want things to be in a certain way for the entire community, but it's not happening. And in the due course, he has actually got four bypass surgeries. I'm sorry, four angioplasties, and now he has been asked for a bypass surgery. and his sugar levels were very high. And last time he came, his sugar levels improved. After a 3 month follow up, it again improved. And he has not done a bypass yet, and he don't want to do it. So yesterday he came for this consultation, and he was saying, I go to so many hospitals, I go to so many places, but the kind of feeling I get at a naturopathy center and the feeling talking to you is different. So we group of people who are coming to naturopathy center, who have been following you for so many years, will look naturopathy as temple of medicine, and you are all gods there. So your work is not less than a god. I said it's too big a word for us. I cannot take it, but yeah, we are trying our best what we can do. What I'm trying to say with this example is we have a larger role to play in the community. People really look up to naturopaths as gods. And for that, we have to really lead by example. We have to make sure that what we say we practice, and then it transmits to the patients and they transform their lives. So, this is how we can be transforming communities. Our target should not be small groups. Yeah. So, that is how from clinician to contributor to a leader we can transform. Now, we have already discussed about the skills which are not taught, but again, to recapitulate, it is important that communication, team management, execution of programs, the understanding of how the financial documentation works is a must to grow. And this can happen only by doing. Just by reading or listening, it doesn't happen. Otherwise, there are I was other day reading leadership is a 60 billion industry where every time there is a workshop, every time there is a program happening, thousands of people are enrolling in it. But there is no shortcut to this. There can be experts coming in, talking in. They would share some insights. You might get a certificate, but it's not that you just get the certificate and you become a leader. It just doesn't happen that way. You need to go through this process, and this happens only by doing. So, I would like you to all participate in this process where you communicate with public, go for public appearances, talk with them, understand the problem, what struggle is happening, and how you can create an impact there. You know, I can give you a small task for all of you after the workshop. Those who are not doing communication, not doing public speaking, I would like to give you a task that you can make a small 3 minute video of yourself where you talk about why yoga belongs in hospital, where you can elaborate that yoga is a scientific therapy where customized yoga programs can be given, and so on and so forth. Make a 3 minute yoga video, and then yourself critically analyze it. What were the positives? What were the negatives? And that's how you can gradually make it more impactful. Same way with the team management. When you want to learn these skills, talk to people, try to extract work from them. For this, I would like to give you a small task after the workshop where you should be able to analyze which are the responsibilities you generally tend to avoid. Most of us are apprehensive about our weaknesses. We can't run away from our weaknesses. We need to give time and effort to understand and correct those. Finance, for that, I would suggest you need to work with the admin and finance of your hospital if you're working in or the college, or even start documenting your expenses in the clinic in a structured manner so that gradually you improve your documentation and reporting. Be it finance or be it project proposal writing, the documentation part is the crucial. Now, coming to the evidence, ethics, and credibility in the global arena. I have seen that integration initially was not so easy for us. We were going and talking to different hospitals how we can collaborate, and they were asking, do you have some data or do you have some documentation? Can you share some figures or facts you have seen in last couple of years? And that is the time where we started documenting. We were actually not documenting. We started uh, seeing how we are doing in terms of IPD patients, OPD patients, how many diabetics we have treated, how many hypertensives we have treated, how many arthritic patients we are treating. Then we started gradually documenting the percentage of relief in terms of pain analog scale or stress scales or different questionnaires. And after a year or two, when we had some data, we went back to those doctors and hospitals where we shared that in a year we treated these many patients. Out of these many patients, there were so many diabetic patients, and then the success ratio was so much. And then gradually we started sharing more authentic data with them, which was gradually becoming evidence based. We started giving references about how research has helped us improvise. And then evidence started talking for us. So the acceptance from this community was much better. And now I can say we are blessed to have a lot of naturopathy and yoga researchers who are doing a commendable job creating our global presence and making things easy for us. But we also, as clinicians, need to document everything in a way that we can also contribute, and then global acceptance becomes much easy. The credibility of naturopathy and yoga professionals grow a way we all look forward to. We need to not be expressing to the common man what naturopathy is. Instead, what we expect is they know what we are already. So for that, we need to have a evidence-based approach and the scientific language being used in our presentations. So now towards the end, what I would like to come back to you is this process is going to be difficult. It's not that easy, but consistency is important. We should be ready for rejections from people, from institute, what we are doing. The growth will be much slower than what we expect. It's not going to happen fast. We will be questioned by people about our approach, what we adopt to achieve these goals. But you should try and see what works best for you and gradually make changes. You should not be lying low if at all you receive some criticism. Criticism is going to help you improve. So take it positively, start working on the core principles and your skill sets, and then gradually we'll see that you are doing better. So these are going to be long period without recognition. You will be practicing for years together, doing these things, excelling in these areas, but you will not get any recognition. But a day will come where your hard work will be recognized by your activity, the way you are representing, the way you are working. So your work will talk more louder than what exactly you are doing. Yeah. For that, we have to have the process corrected. Continuous self-education is another thing. In the beginning, I said that doctor profession is such that we need to educate ourselves every day. Every single day, we need to refer, we need to learn more about our own system and different therapies or the medicines, what is around us. Because without that awareness, we cannot justify the treatments what we are giving to our patients. So leadership is earned and it cannot be declared that I am a leader now. Yeah. The common mistakes what usually we leaders do is we wait for somebody's permission, we want to ask more questions, have clarity and then do it, but we waste a lot of time in the process. We need to avoid administrative processes. If we want to do something, we have to just start doing it, not wait for some protocols to come and it will be given to us, then we will follow. Most of the time in BNYS community, we see that we wait for the Naturopathy Day guidelines or the IDY guidelines to come and then we will start. Usually it comes at the last minute, the 11th hour, we have no much time and we want to prepare for it. And then we land up not doing much. So instead, whatever our gut feeling says us, we should plan in advance, make sure that we execute our plans. Sometimes it may not be the best of plans, but at least we should try hard so that at least we create an impact in the community. Now, staying in the comfort zone is another thing which most of us like to do, but that is not going to take us beyond a certain level. For that, we need to be uncomfortable. Leadership is going to be uncomfortable. And rejection from modern systems, we all have been experiencing. But my experience, as I told, is not that if we are doing the right approach, if we are able to express in the right manner, then rejections are bare minimum. And also, we should not confuse if we are having good popularity with impact, then we should not be getting confused because being popular and being impactful are two different things. We need to think of impact. Popularity may automatically come behind us, because if you're creating impact, people will recognize. With the word of mouth, it will reach to masses, and then things might fall in place. So now the last part is, if you want to be leader, what module you can make. So I'm going to share a brief module for all of you, which will help you become a leader in the days to come. For that, the task is you have to make 10-year impact vision. What impact would you like to make in the next 10 years? Write down those impactful 5 to 10 pointers, and then make sure you see which is the most interesting one for you, which one you feel that you'll be able to deliver, and then start working on those. Similarly, you can also think of one system which is in the advocacy level which is not right, and you want to change it. You can take that as one of the important tasks for yourself. You can think of an uncomfortable skill which you want to learn, which you were hiding from. You were trying to stay away from it, but you want to learn from it. So think of that uncomfortable skill you want to learn. Now, also, if you want to become mentor in one particular area, then you can excel in that, and you can become mentor for many people in the community. And similarly, you have to think of a sacrifice, what you can sacrifice for the community. Time is precious. In today's world, we don't have time for our own self, our own families. So, what is the sacrifice you can give for your community? Because whatever we achieve in this profession is because of the community. And if you want to give it back, then what is that you can compromise to give yourself in the community? So if you just think of these points, it will help you curate your own career path so that you evolve as a better leader in the days to come. So you need to be honest with yourself that what exactly you'll be able to deliver it to the community, but you need to be consistent once you decide on that. Yeah. Now, in the last generations, we have seen that the knowledge was preserved, but in this generation of healers, we have a greater responsibility to play. So, what we can do is we can systematize the programs we have, we can validate the treatment protocols, and we can integrate with people and then lead by example. So, the future would depend on people who stands up now. If we all restrict ourselves to our comfort zone, our own clinics or small setups, then we are not going to grow. The future of medicine would depend on leadership now. And the clinics, we see that we can create trust, but we need to create a change. And that can happen through leaders like us. So we need to really stand up now for ourselves, for our community, and see what best we can do. So I would request all of you, don't just become a better clinician, try to become a builder of systems, how you can make a better system. Think about those lines. Now, coming towards the end of this program, I would like to give you some take home messages, which is most important for us. I'm sure all of you were jotting down the important ideas, the thoughts which I was able to trigger in your minds, so that going behind after this session, you can also think what really helped you understand what was the areas you connected really well. And for that, this take home messages is a must, according to me. So, clinical excellence is the foundation and not the finish line. Understand that in our system, we need to keep on working on excellence. We need to keep brushing our skills in such a way that each time we meet the same patient, we would be able to give something more, something better, something practical. And that is how the clinical excellence would happen. But that is not the final target we all are looking at. We need to think beyond the clinic. Yeah. Second important thing is leadership would begin the day you take responsibility beyond yourself. We all tend to think about my clinic, my practice, my earning, but we need to think about my patient, my community, how it can grow. So there is a whole lot of difference. Here we have a lot of selfish objective, but when we think about the world around us, how we can help, then actual leadership evolves. Then the ideas comes into our mind. Then we start thinking, how can we collaborate? How can we make things happen? When we want something to achieve, we work towards it. If we want to benefit the community, we would naturally go and meet the authorities, the people around, the manpower whom we can mobilize, and then one particular activity can be done. So this is how leadership would evolve. So just thinking about others and not thinking about your personal interest makes a lot of difference. Next important thing would be career growth, which happens through parallel efforts. It would not suddenly happen, no sudden transition would happen in your life. So you will have to do parallelly a lot of things along with your direct responsibility in a clinic, in a hospital, in a college, or in a research institute. Just one thing may not be good enough to evolve as a leader. You need to do something parallelly, which happens all the time. Similarly, leadership skills would be brought through discomfort, and there is no shortcut course which you do and you become a leader. So you have to make sure that you keep coming out of your comfort zone and acquire a lot of skill, lot of knowledge set, execute it, express it practically in public forums where your inhibitions reduce, your expression improves, and then you are recognized better. And similarly, the future of naturopathy, according to me, yoga, integrative medicine would depend on who would lead from here now. So we all need to stand up, and the population of the country, the global healthcare challenges are growing. So we need many more leaders to lead from the front and help the community. And last, clinics are where we begin. So leadership is where our responsibility truly starts. So these were the take-home messages from my side, and I hope you had a comfortable understanding about my points which I had through my journey in last couple of years. And yeah, we are open to some questions if you have. Thank you for your patient listening. Thank you.
Thank you so much, Dr. Abhishek. It was a really a wonderful session, and you have truly proved you are a true leader among us.
Thank
And
you. Thank you so much.
you have done such an excellent work for the community, and the way you took today's session was something extraordinary. What I thought was something very valuable had been given to the community, and your contribution will be always remembered. Your hard work, your presentation will be always remembered by every one of us who were present for today's session.
Thank
Uh,
you.
with the question and answer session, uh, before that, we had also had a prayer meeting. So few people have joined with us for the thought of prayer. So I would like to invite them to speak on our behalf. Uma Bhai, you're there on, I think his audio is stuck. Yes. You can please unmute. Yes.
जी भैया, क्या बोलूं, मतलब सच्ची शॉकिंग न्यूज फॉर अस।
Dr. Abhishek, um, I request you to take the lead
Yeah.
and take up today's prayer meeting where we offer our prayers to late Dr. Abhay sir, who was one of the most important pillar of our community, who has done such great things for all of us, being a pro vice chancellor at Subharti University, and he has guided a lot of students, doctors. I think you will be the best person to take up the lead today and guide
Yes.
everyone with achievements.
Yes, certainly, Vivek bhai. Yeah, so it was a real shocking news for all of us yesterday when we got to know about the sad demise of Dr. Abhay Shankar Gowda. And It was really shocking because he was such a dynamic personality. I've learned from him. He was my mentor. He was my teacher in the college, and such a dynamic personality, always cheerful and always helpful to all of us. And this was something we were not expecting. As a community, it was a huge loss because from a lecturer to professor, and then his journey was something we all were looking forward to. In just a span of couple of years, he managed to become the pro vice chancellor of Subharti Medical University, which was really some big achievement. As a community member, we were all really proud of him, and we always look up to him. But we were completely taken aback, completely shocked with the news that he had a stroke, and then he struggled for three days, and he fought for 3 complete days, and yesterday morning, sadly, he passed away. So it was a truly shocking news and a huge loss to the entire BNYS community because we lost a gem of a person, a true hero for all of us, because I've seen him as a teacher, as a mentor, as a professor, and in all the conferences, whenever we met, he had always given us some simple insights about how we can improve, how we can do better in our field. He has always been a role model for all of us. And with this news, we were all completely shocked. We were discussing, should we do this program today or not? Should we held it back? But Dr. Vivek Bharti came up with the idea that let us do the prayer meeting along with this session, which was definitely a very good idea because we all want to meet and pay our homage, our condolences to him and his family. We know his family, his wife, Madam, was always so helpful to all of us in the college days. His daughter Prithvi, who is currently in Russia studying there. So I really pray to the God, give his family the strength to bear this huge loss in this tough situation, because it's not easy losing someone beloved. And if it is our own family member, it is not easy. Nobody can replace such a person in our life. We can't think of losing a family member, and losing a gem of person like him is really disastrous. And I just pray to God that God give him strength to his family, and he should be resting in peace. Ultimately, it's God who decides, and we should be supportive in these tough times. We have reached out to his family also. As a BNYS community, whatever we can express and extend from our side, we should be able to do that. So, for that, I'm really happy that so many people have joined this prayer meet also. With that, I would like to just give my heartiest condolence to him and his family and this sad demise of Dr. Abhay Shankar Gowda ji.
At times, words feel inadequate, but we would like to remember that we all know that the body is temporary. So the work done with sincerity and love becomes eternal. So Dr. Abhay Bhai's values, teachings, and contributions will continue to guide us. I really feel bad for the family and sad for the family, but may God give them strength, courage, and peace to bear this irreparable loss. So let us offer a calm 30 seconds prayer from all of us. If anyone would like to speak anything more, they can unmute and they can speak before we go for the prayer. Any one of you would like to speak any few words? Dr. Krishna?
Can you hear me, Vivek?
Yeah, I can hear you, Dr. Krishna.
Thank you for this opportunity. It's really nice to see you all. And then when I saw the message of the prayer meeting, I really wanted to join this meeting. And offer my heartfelt condolences, and we all know that it's very shocking and sad news. Abhaya was really a gem of a person. I mean, I had an opportunity to be with him for a few years of my BNYS life, and also when he joined later as a faculty in the college, and had a great time during my internship as well, to be with him, to be guided by him, and even afterwards. I couldn't resist being and remembering about him, and a great loss to his family and all of us as a community. And I really express my very, very heartfelt condolences. And this is a serious and very big loss to all of us. And he will be in our prayers, our memories, and forever. And it's actually uh, great, and I'm really speechless as you all are, and really feel very, very sad for this untimely demise, actually. And as you said already, I mean, we all know that our bodies, like our physical bodies, has a limit of time, but it's really shocking at times when you hear this news, which is very untimely and very sad to hear this. And I would like to join you all with all my prayers and wishes from my side. Thank you.
Thank you. Anyone else would like to speak? They can unmute and go ahead. Kanak bhai, you would like?
Namaste, everyone. It's a great shock for all of us. And recently, Abhay has visited me and Swamiji also, along with Dr. Raghavendra Rao sir, 3 months back. And he was all fit and fine, and he was in his good health. And suddenly, what happened? He got a stroke, and in one day only, the life has changed. The Subharti Institute also. So it's been a very shocking for all of us, and for personally for me, because we were communicating regularly for different works of NAC and for different BNYS curriculum works. We were in very close contact and touch, and such a gentle person. He has made in the north of the India, the he made BNY so strong. He was the reason. Because of that, the UP BNYS registration has started, and Subharti College reached 200 BNYS seats for 1 year. That and all, as professionally and personally also, he was so much hardworking and so much concerned about everyone, like for the community, that he was giving his 100% efforts for the system and for the welfare of the students, like personally for each one. And such a jolly and genuine person, strict for the students, yes, that is discipline. He teaches to be disciplined, yes, that is the must for becoming a great doctor. uh, and although he was also a great doctor also, so we have been like in contact with many patients interreferring. So such a good rapport among the patients also he had. So like it was very shocking. Suddenly that day evening only, the doctors over there, they told that suddenly he got CVA. So means it's really shocking for us. So my message is like, take care of your health also. Like work is, of course, the first thing one need to do for the service. But like as a BNYS doctors also, we should like focus on our health, our mental health, and look for our friends, our colleagues, their health, help them whenever need, and keep motivating, inspiring each other, and ask everyone to get the things checked. Yes, we cannot say when the death can come. It's a universal thing that God can call any time. But still, like I feel at this young age, that is not a time he should be going. And because he's doing yoga also regularly, taking care of his health. Like his blood profile was also fine, and like he was in a normal health. But his colleagues told me, the doctors, that since 2 3 days he was getting some headache and some nausea. 2 3 times he had vomiting, but they had some event at Subharti for BNY students, so he ignored those symptoms. And 1 2 times he didn't share with the next doctor who are taking, Dr. Dhiren, Dr. Abhay. So like whenever you feel you're not all right, so immediately I think that what can be prevented, we should try to prevent that. So share yourself up, don't keep mentally like up to yourself. Share with your colleagues, doctors, or friends, families, whoever are close to you. So it's like feeling very bad. And like uh, may his soul rest in peace, and he stays an inspiration for all of our BNYS community, and the patients and the students forever will keep him in the good memories, the good time spent with him. We were first year, our BNYS admission was done by Dr. Abhay, and he was taking the PNC also. So he was the first person who introduced our batch of BNYS at SDM to the naturopathy. So initially, he was a core believer of allopathy medicine, but during the right from 2007 8 to till today, I have seen so much mental uh, changes in him. He was a strong believer of yoga and naturopathy medicine. So last time also he visited my home like 3 4 months back. That time also he was strongly suggesting that this lifestyle can actually bring so much changes. The allopathy doctors in Subharti, the super specialists, they are accepting this, adapting the system of diet, nutrition, and naturopathy. So like always, he will be a motivation for all of us. And Om Shanti. Thank you. My heartiest condolences. Thank you, Besar. Thank you, everyone.
With this, we'll keep 30 seconds of moun to offer our prayer to our beloved Dr. Abhay Shankar Gadabai, who had been a guiding force for all of us, a strong pillar of strength, but we really miss him. Let's pray with our whole heart. Om Shantihi, Shantihi, Shantihi.
शांति।
Now, I do believe that we all loved him so much, and this prayer meeting is just a small token of our remembrance to him for his all his contributions, all these years, the way he has transformed everyone's life. He was not only a dedicated doctor, but he was a very gentle human being. He lived life of service, compassion, and simplicity. He healed many people. He inspired many of us. His commitment to a system and ethical practice I think it will be always remembered. With that, we close our prayer session.
Thank you so much for organizing this, Vivek Bhaiya and team. It's really nice to see this happening and great to join this.
With that, we end up today's session also, which was very well presented by Dr. Abhishek Bhai. I request him to share his number in the chat. So the doctors and interns who have joined for today's session, they can go ahead with their question and answers. And I know you will be the guiding force for them, the way you have done in today's session.
Sure, it'll be a pleasure to help more people. If I can make some impact in people's life and guide them, I'll be really happy. I'm sharing my number in the chat box. You can always reach out to me in case I'm not available at first chance. You can always drop me a text. I can always come back to you. Yeah. Thank you again. Thank you for having me on this forum to share my insights. Thank you.
We have received a compliment for you. Thank you for your teaching and sharing great ideas, sir. Thank you so much, by Dr. Dharun Raj. And all the doctors, we have a comment from Dr. Anubhuti Saxena. Exactly what we were hoping to hear, sir. We could hear from your session. We are grateful for the opportunity to attend your session. The information shared was extremely valuable, by Dr. Anubhuti Saxena.
Thank you. Thank you.
So I think the guidance what you have created today is the actual guidance needed for almost all the students and the BNYS doctors, because actually they are missing this. I think this should be done in a very larger platform by you, because the way you have shared your knowledge, the way you have expressed everything, it makes really valuable for the whole community. This session will be viewed by more than thousands of people, as recording has been already done. So it will continue to guide those souls, the BNYS students, interns, and doctors. So this recorded session will be also there in the YouTube. So I think this will help the upcoming community generations to watch it and get a great guidance what you have delivered today in your session. So I do believe what you are doing is something extraordinary. The way you speak, you have such a great uh, simplicity, but yet glamorous. This is the word I would like to just say to you. And definitely, you are a very good-hearted person, very down to earth. You have gained such a great popularity throughout the India. You are known to everyone, but you meet everyone with so much of love and care. And I always feel that you are a gem of person among our community. And having you in today's platform not only helps the one who have attended, but also those who will be listening to this entire session, because I do believe this is one of the best session which has been done in this community. So
Thank you so much. Thank you for the kind words. And I would be really happy to share more. Uh, I think such programs, what you are conducting, is really required for our community because we lack this kind of practical knowledge. Because what we study in the college is different, and what we practice in clinic and real life setup is completely different. So even your experience, your journey, all of us had a great journey, and we all learn from our mistakes, and we are learning on a daily basis. So this has to be propagated, this has to be shared with people. And my effort always has been not to keep any secrets, share as much as possible, because sharing will make me more strong. And that is how we should all be growing. We all should grow together. That is my vision is. So let us work for it. And anytime such talk or session is required, I'll be happy to host. I'll be happy to deliver a talk again if required. So thank you so much for having me here. Thank you.
I'll be writing on my behalf to all the college principals to make your session mandatory for everyone so that the entire all the colleges, this will be my personal letter from to all of the principals because I have contact details of everyone, email IDs and everyone. Um, so I'll be sending them the mail regarding this. Dr. Abhishek's session should be conducted for everyone. We have received very valuable and positive feedbacks from the attendees. Rajeshwari ji says that thank you, sir, for your inspiring talk. The point on communication really made the mark. Ashi he says that thank you, sir. Your guidance is something very best and it is upgrading our knowledge. So I think with this, we conclude our today's session with a lot of learnings and of course the prayer what we have offered today that had been a sincere effort from all of us because we are family and will keep continue to grow and make each other proud the way we do our work. So thank you so much.
Thank you. Thank you.